Welcome to OOTO TV, the out-of-the-office investigation from our past into the future of personal health and psychophysiological actualization. This time we're discussing frequency-specific microcurrent therapy, healing through frequency-specific microcurrent health therapy. Hello everyone, I'm Beauchamp, and I'm really excited about the material we're looking at today. It's an investigation into a non-invasive treatment that, honestly, seems almost like science fiction.
And I'm Pasteur. Our mission today is to investigate frequency-specific microcurrent, or FSM, therapy. We've gone through some really compelling clinical research and foundational theory to understand how these tiny electrical currents, tuned just right, might be impacting our health.
Right, on both a cellular and a systemic level, we're going to explore FSM's core mechanism, which is all about something called biological resonance.
And from there, we'll look at its potential to regulate the autonomic nervous system, inflammation, and its demonstrable effects across some really diverse conditions.
Just like chronic stress, pain, and even really tough connective tissue disorders like scleroderma.
Essentially, we're examining the evidence that FSM could be a non-pharmacological way to help the body find its way back to balance. So let's start with the basics, the electrical foundation of it all.
Okay, let's start there. The current itself. We're not talking about something like a 10S unit, nothing you'd really feel, right?
Not at all, no. FSM uses an extremely low-level current. It's measured in microamperes, which is 1/1,000,000th of an ampere. It's so gentle that it's actually subsensory.
Subsensory, meaning you probably won't feel it at all while it's working.
Exactly. The devices are FDA approved as being safe, but the critical part isn't the strength of the current, it's the tuning.
Okay, that brings me to my first big question. What are the key elements for FSM therapy? What makes it work?
The key is resonance, specificity through resonance. The whole principle is grounded in biological resonance. You can almost imagine the body as this complex network of circuits.
And the frequencies are targeting specific parts of that circuit.
Precisely. FSM uses paired frequencies. One frequency targets the specific tissue you want to treat, say, a nerve or a muscle, and the second frequency targets the condition, like inflammation or scarring.
So for any of this to be possible, the foundational idea is that the body is inherently electrical.
That's the core assumption. FSM therapy suggests our bodies are electric, and each organ and muscle has a frequency that may be modulated for good, for health. These frequency pairs are thought to literally match the electromagnetic signature of what you're trying to address.
And many of these frequencies have been around for a while, I understand.
They have. A lot of them came from a list that was discovered nearly a century ago, back in 1922. It's really all about communication on a biological level.
And if you get that communication right, what's the immediate effect? What do you actually see happen?
This is what's so fascinating.
Yeah.
Practitioners consistently report a profound and palpable tissue softening and warming. And this happens within seconds of applying the right frequency.
Seconds. And you're saying this isn't just on the surface?
No, it happens in deep skeletal muscle. It's a real physical change.
Okay, but the immediate question is, how do we know that softening isn't just, say, increased blood flow from the treatment or heat from the electrodes?
That's a crucial point. The theory suggests this is way more than that. It's addressing the underlying pathophysiology, specifically the chronic tension or hypertonicity that builds up from stress or an injury.
So a muscle gets stuck in a state of tension.
Right. The feedback loops that regulate its tone, they're called the gamma efferent loops, can get kind of stuck on high. The theory, sometimes called Core's hypothesis, is that FSM helps reset those loops. It reduces that sustained sympathetic tone.
So it's like a nervous system reset, but happening right there in the tissue.
That's a great way to put it. And beyond that neurological reset, we also know that microcurrent increases ATP, that's the energy currency of our cells, and it modulates cellular signaling pathways.
More energy and better communication for the cells.
Exactly. And when cells have the right energy and the right signals, they can switch from that defense mode into repair mode. So in short, FSM therapy stimulates a healthy environment for cellular growth and success. You're providing the precise electrical support for self-repair.
You're listening to OOTO TV with research by author Paul Bielo. So it's like you're tuning all the body's little instruments before you ask it to play a symphony. That kind of support must have huge implications when you zoom out to the entire nervous system.
It absolutely does, which is a perfect transition from the local effects to the systemic ones, especially FSM's influence on stress and our mental health.
So how can FSM therapy affect our mental and physical health? How does that jump happen?
Well, we have to connect the dots between that chronic physical tension and our emotional state. Things like PTSD, anxiety, depression, they are completely linked to physical patterns.
You mean things like inflammation in the brain?
Exactly. Neuroinflammation, poor regulation of the vagus nerve, and an overactive stress response system, the HPA axis. The brain just doesn't work optimally when it's inflamed and on high alert.
And the vagus nerve really is that bridge between the physical and the emotional, isn't it?
It's the master regulator. It's central to polyvagal theory. The vagus nerve dictates heart rate variability. It controls stress hormone secretion, and it manages that fundamental switch between the sympathetic fight or flight system.
And the parasympathetic rest and repair system. Chronic stress basically damages that switch.
It damages the vagal tone, yes. It can lock the body into a state of constant hypervigilance.
And FSM's goal is to, what? Nudge that system back towards the parasympathetic, the rest and repair side.
The goal is to apply frequencies that are thought to specifically support vagal tone, and by boosting that parasympathetic function, the nervous system can finally climb out of that chronic fight or flight cycle.
The result being a more stable mood, maybe deeper sleep.
Deeper sleep, improved emotional resilience, and these are all things you can measure.
This brings up another really interesting idea, the cell danger response, or CDR. Can you break that down for us?
Sure. The cell danger response is this idea that when our cells face trauma or chronic stress, they go into an inflammatory defense state. Think of it like a castle pulling up the drawbridge.
Okay, so it's shutting down normal operations to defend itself.
Right. And while it's defending, it can't repair or regenerate. FSM, by regulating the nervous system and supporting the mitochondria, it seems to be signaling safety. It's telling the cells they can lower the drawbridge and get back to their normal recovery work.
And we have some pretty concrete evidence of this stress-reducing effect from a pilot study, a randomized controlled trial.
We do. They looked at adults with clinically significant stress levels. They compared FSM alone and FSM with relaxation against just relaxation and a placebo.
And what did they find?
The findings were very promising. The people who received FSM reported significantly fewer somatic symptoms, those are the physical signs of stress, and fewer negative emotions than the group who only got relaxation, and that was after just 6 sessions.
That part is key. It suggests FSM might offer faster, more immediate relief for the physical side of stress than just relaxation techniques alone. It's like it's actively changing the physical state first.
I think so. The improvements were really broad in the FSM groups. Better emotional regulation, less perceived stress, and a measurable increase in serenity.
Was there anything else that stood out?
Yes, one psychological metric I found particularly interesting was self-efficacy. That's the belief in your own ability to handle challenges. That improved significantly only in the FSM group after about 6 to 12 sessions, not in the control groups.
That's profound. It suggests that when you stabilize the body physiologically, you provide a real foundation for psychological empowerment. A calmer body leads to a more capable feeling mind.
Exactly. So now let's take that powerful effect on inflammation and apply it to one of the toughest areas in medicine: chronic pain and tissue damage.
You're listening to OOTO TV with research by author Paul Bullo. Okay, so can FSM therapy improve our human health when it comes to something as stubborn as chronic pain? The data on fibromyalgia seems to suggest a pretty compelling yes.
Let's talk about that landmark study. It was on fibromyalgia that was associated with cervical spine trauma. They used very specific frequencies, 40 hertz and 10 hertz.
And the results?
The pain reduction was, it was nothing short of extraordinary. The average pain score dropped from a 7.3 to a 1.3.
Wait, from 7.3 down to 1.3. That's almost a complete stop to debilitating chronic pain.
And this was after a single 90-minute treatment session.
In less than 2 hours. That's a massive finding.
And here is where the science really backs up the subjective experience. They biochemically validated the effect.
How'd they do that?
The treatment significantly lowered key inflammatory markers, these molecular messengers of pain, specifically cytokines like IL-1, IL-6, and TNF-alpha, along with something called substance P.
So it's not just a feeling of relaxation.
Yeah.
It's a real, measurable, anti-inflammatory shift happening in the body.
Precisely. And based on that speed and that magnitude of change, it seems clear that exposure to FSM is critical to our healthy recovery and pain reduction.
It's like you're hitting the pause button on the entire inflammatory cascade. The implications go way beyond just localized pain.
They do. We also have pilot evidence for its potential in conditions that are really defined by scarring and structural damage, like systemic sclerosis or scleroderma.
Scleroderma, which involves severe scarring of capillaries and connective tissue, right?
Right.
Often leading to a serious loss of hand function.
It's a profound loss, yes. So the FSM approach there was to target the pathology directly. They used frequencies for the condition like scarring, sclerosis, and vitality, and combined them with frequencies for the damaged tissues themselves, skin, connective tissue, and capillaries.
And did it work?
The functional improvement was startling. Across 2 pilot studies, patients saw an average improvement of 40% in their hand function score.
40%. Over a very short treatment period, too, I believe.
Sometimes just 45 minutes. The anecdotal results are what really bring it home. A patient who found picking up coins nearly impossible could suddenly do it without difficulty.
I remember reading about a musician who could play his double bass again because the sensitivity came back to his fingers.
These are just remarkable shifts. But, while we're talking about these incredible results, it is important to inject a note of caution here.
Of course. To keep ourselves grounded in the context of the research.
Absolutely. While the scale of change in these studies is undeniably impressive and strongly suggests a real effect, we have to be impartial. These were non-randomized pilot studies with small sample sizes.
So they show incredible potential, but they're still preliminary.
Exactly. We need to see this replicated in larger, definitive, randomized controlled trials. Future research needs to confirm it all with more objective measures, like tracking cortisol or heart rate variability, or even grip strength.
Especially for long-term management of these more severe diseases.
Right, but the potential is clearly there.
We've covered a huge spectrum here today, from a subsensory electrical current all the way up to systemic nervous system regulation.
If we were to synthesize what we've learned, I'd say FSM operates on this powerful duality. On one hand, it acts directly at the cellular level, decreasing inflammatory cytokines, increasing ATP, telling the cell to stop panicking.
And at the same time, it's rebalancing the whole macro system.
Yeah.
It's supporting the vagus nerve. It's dampening that chronic stress response. It's an electrical rebalancing act with these huge physical and psychological consequences.
And we really can't overstate the speed of the effect. Tissue softening in seconds. Profound pain relief in a single session. This rapid impact is what really sets FSM apart.
And when you connect all those dots, the reduced inflammation, the lower stress markers, the improved tissue repair, the long-term implications become very clear. It seems FSM therapy can be linked to pain reduction, improved mood, and increased longevity.
It's addressing the core mechanisms that drive so many chronic diseases. The existing evidence really does support FSM as a highly promising, non-invasive intervention.
You're listening to OOTO-TV with research by author Paul Bulow. It really suggests that for so many conditions that are resistant to conventional medicine, maybe the answer is providing the body with the right bioelectrical information.
The right information at the right frequency might just be what unlocks the body's own healing mechanisms.
Which leaves us with a final provocative thought as we look to the future of our health. Considering this complex web of physical trauma, chronic stress, neuroinflammation, and tissue pathology, and seeing how FSM seems to influence all of these interconnected layers at once.
It makes you wonder.
It really does. We have to ask, if the body's healing is fundamentally electrical, how much of our future healthcare might rely not primarily on chemistry, but on achieving perfect bioresonance, frequency by frequency?
A question that definitely demands more investigation.
Indeed it does. Thank you for joining us for this investigation.